Welcome to the Facebook Live follow-up discussion for the TV special, What Every Family Needs to Know About Opioids. Joining me are David Zahn at the DEA, Dr. Ann Zink, the State of Alaska Chief Medical Officer, and Michael Carson, the Chair of the Matsu Opioid Task Force. If you have a question for our guests, please enter the questions in the comments box below. We'll start with David Zahn. Now, David, earlier in our program, we talked about the DEA's prevention and education efforts on a national level. Could you tell us more about the educational initiatives the DEA is spearheading in Anchorage?
Yeah, thank you, Katelyn, and thank you everyone for joining us on Facebook Live. As was mentioned in the program, DEA rolled out Operation Engage in 11 cities nationwide, Anchorage being one of them. Operation Engage is a comprehensive initiative combining law enforcement with community outreach. We've had a lot of successes in Anchorage here so far. Just a few highlights is this week is Red Ribbon Week. We have one of the local municipality buildings downtown is lit up red in honor of Special Agent Kiki Camarino and support of Red Ribbon Week. We've had our special K-9 coho going around to classrooms throughout the Anchorage School District, helping to spread our drug-free message. We've also partnered with the Alaska National Guard Counter Drug Program. We've put on a successful rope course where kids come out and work on team building skills, as well as receive a drug-free, healthy choices lifestyle. And we've also worked with them. We've partnered with the counter drug folks as well to put out a drug-free looks like me message. We've also conducted two successful national take-back days here in Anchorage, where we collect unwanted and unused prescription pills so they don't end up being abused.
And what is law enforcement finding in terms of criminal activity in the peddling of opioids, both artificial and otherwise? Where are the drugs coming from, and what is the DEA doing to curb this criminal activity?
So what we find a lot with drug trafficking networks is they're what we call polydrug networks. They traffic in more than one drug. So they'll be selling heroin, methamphetamine, and counterfeit pills at the same time. The DEA is committed to targeting these organizations, dismantling them. A lot of these drugs, or most of these illegal drugs, make it in the United States from overseas. A lot of them are trafficked into the U.S. by cartels operating out of Mexico that come into the lower 48 and then make their way to Alaska, often via the ports, the airport, U.S. mail, and other shipping methods. And as I mentioned, DEA, we're partnering with all of our local, state, other federal agencies to work together to disrupt and dismantle these organizations here in Anchorage, throughout Alaska, and wherever they may be operating.
And can you tell us more about counterfeit pills? Like, how big of a problem is this in Anchorage?
Yes, so the DEA has seen a huge increase in counterfeit pills. This year alone, the DEA has seized 9.5 million prescription pills, 7.8 million of those containing fentanyl, which is more than the last 2 years combined. And to make the threat even worse is these pills are being manufactured to look identical to prescription pills. So they're being made to look exactly like oxycodone pills or hydrocodone pills. So that's just why it's so important that we're trying to get the message out there that if a pill is not prescribed to you, don't take it.
Absolutely. And David, we have a lot of caregivers and parents watching tonight. I'm sure there are questions as to how easy it is for kids to get drugs in Anchorage.
Yeah, so I know a lot of times people think of drug trafficking, they think of a drug dealer on a street corner or something like that. But unfortunately, there's other ways that the drugs are making it to our youth and young adults. One way is often they're being stolen out of the home of a friend or family member, which, as I mentioned earlier, is why DEA conducts the national take back twice a year to try to get those dangerous drugs out of the home after they're no longer needed. In addition, we've seen a huge increase with the counterfeit pills of them being purchased on social media. So that basically means any teen or young adult with a smartphone has access to these markets.
Absolutely. And can you tell us a little bit about fentanyl? Why does it affect some people more than others? Some people die, other people's it doesn't affect them the same way. What is it about fentanyl?
Well, one of the problems what we're seeing with fentanyl, and fentanyl being one of the main ingredients in the counterfeit pills, is these counterfeit pills are being produced in clandestine laboratories overseas, where there's little to no quality control. So when these pills are manufactured, one pill may contain no fentanyl, where another pill may contain a lethal dose, and there's no way without testing to know the difference. So that's part of the reason that DEA has come out with the public safety alert of one pill can kill. And it is so important to stress the message that if it's not a pill prescribed to you, don't take it.
Absolutely. And moving over to the Chief Medical Officer, State of Alaska, Dr. Ann Zink. Now, doctor, we hear a lot about the dangers of prescription opioids and painkillers. Could you clarify for our viewers when someone should take painkillers? How long does it take for a person to become dependent on these types of opioids?
Yeah, so pain is a signal that your body is hurt and something is wrong. And so the best thing we can do is try to address that underlying cause of pain. You break your ankle or sprain a wrist, splinting it, icing it, elevation is going to be the best way to heal that pain. It can also be important to try to address the pain with non-opioids. There's actually been some interesting studies that show that Tylenol and ibuprofen taken together are actually more effective than oxycodone for a lot of pain, including pain from traumas like accidents and broken bones, other sorts of things. They don't contain the same risk of addiction. Opioids can be very useful, particularly in end-of-life settings, cancer. I mean, they can be very potent painkillers. But different people have different risks of addiction. For some people, just taking them once can be enough. They can start to use them on a much more regular basis and start to become addicted. And any one of us who is exposed to these opioids on a regular basis will have chemical changes in our body that makes us more susceptible to needing more of them to get the same pain relief. And it doesn't decrease our ability to not overdose if we take too much. So if we have a little bit of extra, we can stop breathing, or if you get another infection, something else. So even elderly people who are on chronic pain medication, something like a urinary tract infection can be enough to tip them over the edge. So in general, avoiding opioids is honestly our best option for pain. There is a role for them and they can be very useful drugs, but it really needs to be done in combination with your doctor, managed carefully, just as David just mentioned, as a prescription where we know how it was written, we have quality insurance over it. And then as soon as they're done, that they're properly disposed of, so someone else doesn't accidentally get into them. Because for a young kid, even a prescription that was rightfully written, one pill can kill. And then just as David really eloquently went through, what's on the market right now is scary. You might just think that you're taking another hydrocodone that your friend gave you because your back hurts and that worked for you before, but it might have a lethal dose of fentanyl in it. And that's why it's so important to work with your primary care doctor or whoever your provider is if you're experiencing pain.
Absolutely. And one thing that we mentioned during our program that I think is really important that we review again is we call this a disease rather than an addiction. Why is that?
Yeah, so disease is anything that affects the structure or function of a living system. So an animal or human that causes some sort of problem in that structure or function that doesn't come from an external source. So bacteria, viruses, medications can all be diseases, and diseases can chronically happen and they affect the way that someone interacts. When we use the word addiction, there is a set of judgment associated with that. And I think that it undermines the real chemical changes that happens in someone's body when they're chronically exposed to opioids. And there are treatment options for opioid addiction and for pain addiction. And it's really important that we find and use the treatment options that we have available to use instead of judge people who are struggling with addiction, to help them to find better ways to treat their pain that are going to be more effective at treating their pain, as well as to minimize the risk of illicitly using drugs to be able to control their pain and putting them at high risk for overdose and death.
Absolutely. And Michael Carson, you work in recovery. What should people do if they know someone's struggling with substance misuse? Where should they turn for help?
That's a great question, Katelyn. And I think we have to understand, we have to meet the person where they're at. That could be our own child. It could be a relative. It could even be someone on the street, someone in a homeless camp. I think it's very, very important. And I think Anne brought this up. in the sense that these are individuals that are suffering from a disease of addiction, and that we need to really understand that this person is really struggling, and we need to be able to be compassionate, but at the same time, we need to have resources at hand to be able to say, when that window of opportunity opens up, we have to be able to get them access to treatment. And so that is so vital, to be able to have access to substance use treatment. And again, the treatmentconnection.com is a great resource for people, being able to find something close by, so that they can be able to get that loved one to the services that they need. So really important to meet the person where they're at.
Absolutely. And just to remind you viewers, please send us your questions. You can put them directly in the chat and we'd be happy to answer them. Michael, piggybacking off what you're talking about, treatments, how does the person determine what the best treatment or treatment center is for them specifically?
Well, I think people need to realize that the assessment will drive the treatment. Depending on the level, how long the person used, what they're using, the duration, that will all drive what the prescribed treatment may be. It might incur that they need to go to residential for 30 days, 60 days, might be intensive outpatient. So there's different levels of treatment depending on the assessment that a clinician that's trained in the area of substance use disorders would be able to provide the client.
Absolutely. Okay. And Dr. Zink, we have a question from one of our viewers. What are some of the ways people can manage pain without using opioids?
Oh, there's so many. It's one of my favorite questions. It really depends on what the cause of their pain is. So I think it's important to go back to the cause of their pain. First of all, I would state that the mind and body are amazingly interconnected in all sorts of ways. It's incredibly depressing to deal with something that's painful for a long period of time, and it's very painful to be depressed. And so I think making sure that we're taking care of our mental and physical health is really important. Even what you do, such as eating, exercise, diet, and mental health, can make a difference in your overall pain. The second thing is to look at what might be causing that pain. It's important that it gets assessed and addressed. Maybe there's something, maybe it's a cancer. Maybe it is some underlying condition that really needs to be addressed and seen and can be treated with other therapies. So if you're having a chronic pain, it's really important that you get that seen and evaluated, because there might be a surgical option. It might be an infection. There might be some other way that's best able to be treated. Now, say it's something like a sprained ankle or chronic back pain, something we see on a really regular basis. Chronic back pain is best treated oftentimes with exercise, diet, and position, and really strengthening your core muscles. But acutely, it can be very debilitating. And so again, using a combination of non-addictive medications can be very, very effective, such as ibuprofen, Tylenol, icing it right after you had it inflamed, then using heat slowly, stretching, range of motion, physical therapy, massage. All of these things can make a giant difference. I think we also need to be patient with our bodies. Our bodies have pain for a reason. They're telling us that something is hurting, and we need to slow down. We need to have time for pain. We need to be patient with pain. We need to listen to it and address it so that we can help figure out what that is and give ourselves and our bodies time to heal, rather than just masking it with an opioid and going about our business in our day. Because what we see consistently is that when we do that, we increase our mortality. So people who take opioids for, say, chronic back pain have a shorter life expectancy. When we mask our pain, we don't deal with the underlying problem, and we run the risk of addiction or other things. So it's incredibly important you work with your provider to deal with the underlying causes of pain and make sure that you're taking care of your physical and mental health throughout the process.
It's fascinating. You just mentioned that there's a combination of ibuprofen and Tylenol that are just as effective as opioids. Can you clarify this? And can people take these medications as prescribed on the bottle every 4 to 6 hours without complications?
Yeah, so it's important that you always talk to your primary care doctor. If you've got liver issues or kidney troubles, you may not be a good candidate for ibuprofen or Tylenol. If someone has an allergic reaction, those are other things to consider. But ibuprofen and Tylenol are both sold over the counter. Those are brand names, but the generic names, are available and across. You can get them at any grocery store. The study that looked at ibuprofen Tylenol looked at 200 milligrams of ibuprofen and 500 milligrams of Tylenol taken every 6 hours was more effective than 15 milligrams of oxycodone taken at the same time. So 15 milligrams of oxycodone is pretty high dose of oxycodone, and that ibuprofen and Tylenol dosing is well within the Tylenol and ibuprofen dosing that is on the boxes. You don't need super high levels or doses of it. Tylenol and ibuprofen hit different pain receptors, and the combination tends to work better. In the emergency department, I used to write for a lot more opioids, and I think as we have seen risk of addiction, even just with a short course of opioids, and seeing that with multimodal pain approaches, treating people's pain with many different small ways, again, a little bit of ibuprofen, a little bit of Tylenol, some splinting, some icing, that we can actually treat the pain better. I have found that I've been more effective at treating people's pain without using opioids. And most of the time, don't write for opioids for most fractures, sprains, injuries, most things that we had previously written for them. Other things that can be very effective are things like blocks. So for like dental blocks for bad dental pain, actually numbing that nerve itself with long-acting numbing medication until an infection or that rotted tooth could be taken care of. You're addressing that localized pain much better than taking something like an opioid. So lots and lots of options out there, and depending on the reason for the pain, the treatment options are different.
Absolutely. And now, David, outside of the official drug take back program, how can people safely dispose of unused prescription drugs?
Thanks for the question, Katelyn. So we conduct the Operation Take Back twice a year in April and October. But outside of that, if people go to either go to dea.gov and find a link, or deatakeback.com, and if there's a site, and if you put in your zip code, it will give you locations in your area where you can drop off those drugs all year round.
Excellent, excellent. And Michael, can you tell us why is peer-to-peer and community support important in recovery?
Katelyn, your previous question, when you asked about when someone's looking to get someone in treatment, sometimes what we have to do is we have to reach out with someone that's had a lived experience, meaning they know how to talk about, they know the language of the disease. They know what it feels like to have cravings. They know the feeling of wanting to use. They have that lived experience, and that peer-to-peer specialist really has a different relationship than, let's say, a counselor. That peer-to-peer specialist, they're walking side by side with you. And what they're doing is they're supporting you during your course of transitional care into recovery. I have actually a phone number. It's 982-HOPE. And those are peer specialists out in the Valley. And they would be more than willing to take phone calls from people that are hesitant about treatment and have questions about detox, because these people have had that direct experience. So that is a vital component of when we're talking about recovery. And more and more, they're becoming certified peer-to-peer specialists. So it's becoming a making a huge impact for people that are struggling. Again, they know the language. Been there, done that. They've lived it. And the important message, Katelyn, as maybe David has already mentioned, or you yourself, recovery is possible. They need to hear that.
Absolutely. And, the peer-to-peer, that's a great example. I know that people want to know, are there local resources that people can tap into if they don't have insurance and they can't afford maybe rehab or treatment centers?
That's a really great question. And that would depend on each individual provider. And that would be a question that someone would have to seek out. Maybe Dr. Zink knows more about those issues of covered by Medicaid and private insurance and things like that. But I wouldn't hesitate to call a provider and find out. Maybe they have a sliding scale. There could be lots of options out there for people to be able to pay for treatment. So We really need to provide that access. And I think, as Dr. Ann Zink would confirm, is we need immediate access. When that window of opportunity opens, we have to go in. We have to take that person and walk with them side by side across that threshold into recovery.
Absolutely. And I mean, this is for anyone who wants to answer. I mean, we know that this issue impacts all communities, all races, all religions. What can we as a community do to help relieve the stigma of this disease so that people get help and families get the support that they need?
Caitlin, that's a great question. And I think I would build on many of the things that, Michael had just said, and to come back to his comment and to the question about how else can you get support. This takes all of us. This takes policymakers. This takes the public. This takes the press. This takes providers. This takes patients. There's not any one person or any one magic fix for addiction. This takes a whole community. I think that's something I really learned from actually Michael Carson and the team out in Matsu, and the ways that peer-to-peer recovery can make a difference. And you never know when someone's going to be ready for that moment. And so I think not having that stigma, not having that judgment, no one wants to grow up to be addicted to opioids. No one starts taking pain pills and then hope to be addicted. This is a horrible, devastating disease where people are finding themselves making choices they never thought they would make, as their brain and their body is being taken over by this just intense craving that can overtake everything else in their life. And so it's incredibly important that we try to prevent it in the first place. And then if people do become addicted, that we try to support them throughout that process and that recovery. But again, this is going to take every single one of us. And that course through addiction, as Michael just mentioned, hope is possible, recovery is possible. It may not happen on the first time. It may not happen on the 10th time, and it may, but always having that ability and that willingness to move forward. We all make mistakes. We all need second chances. Our bodies all respond differently. We all are differently susceptible to different diseases. And I think it really takes a community and that connection to be able to move forward.
I'd like to piggyback, if you wouldn't mind, Caitlin, on exactly what Ann said. Ann turned me on to a book about 5 years ago called Dreamland. And it's nonfiction. It actually tells you the progression of the opiate epidemic. But the last page, maybe even the last paragraph, is actually a favorite paragraph of Senator Dan Sullivan. He has read it a number of times at different summits, even at the last recovery event that we had out in the Valley, that boots on the ground, the grassroots of communities coming together and being able to create partnerships. I am so thankful for Ann and all her colleagues at Matsu Regional Center out in the Valley, and all the partnerships and collaboration that we can pull together and be able to work together, as Ann said, and not leave anybody behind. We just can't afford to leave anybody behind. And I will have to give a shout out to David and Red Ribbon Week, because we know the disease of addiction is all about isolation. And we know that recovery, as Ann has spoke many times, is about connection and building relationships. And that's what Red Ribbon was all about, David, was you getting out into the community, getting into schools, and building those protective factors for our youth. I'm all about pulling people out of the river of addiction and getting them the treatment, but there's something to say about going upstream and cutting off the flow. We need to be very, very involved in upstream primary prevention with our youth. And I think that means giving them accurate, honest, and current information. And one piece of information that I wanted to add to David, and David might be able to confirm this, I've heard that there's even counterfeit Adderall and Xanax out there. So it's everywhere. It is truly Russian roulette. We cannot allow anyone to take that chance. It's just too dangerous. It is just, we just can't lose anyone.
David, have you seen, these trends happening like you spoke of?
Yeah, no. So Michael's or Mr. Carson's correct. We're finding fentanyl mixed with everything out there. So he said it best when he said it truly is roulette when you do it. That's why it's, we launched the campaign of one pill can kill, because you just don't know what you're getting. It only takes 2 milligrams of fentanyl to be potentially a lethal dose.
Wow. And let's talk about overdose. If God forbid somebody does overdose, there's this Narcan, this miracle drug that can help people and save lives. Where can people get it? And is there a cost? Can you guys educate us on it?
I can think Ann can speak to that with Project Hope and Tim Easterly. He's the go-to guy. And he also has the fentanyl test strips, and he also has the medication disposable bags.
Yeah, so thanks, Michael. Yeah, so we do at the state have Project Hope, which has been great. A couple different things. Naloxone or Narcan is a prescription medication, but the legislation did pass a bill that allows it to be written without a prescription. So there's a standing order, actually, as the state chief medical officer, I'm allowed to write that order that allows us to dispense it across the state, pick it up at pharmacies. So you don't need to see a doctor. You don't need to have a prescription. You can just pick it up at different places. We try to make sure it's available at emergency departments. Honestly, every single one of us should carry one. I have it in the front pouch of my car. My kids have it in their backpacks. They have availability to be able to have it. And honestly, if you're older and you're taking chronic opioids on a regular basis, it should be in your house in case you get an infection. And that's enough to make you stop breathing. If anyone has opioids in their house, drives a car, interacts with other people, they should have it. Just like you get jumper cables, it can make a difference and it can save a life. So just like David's helping to make sure that we don't have opioids on the street, that someone can accidentally take a pill where one pill can kill. If someone does, we can offer people the chance at recovery and the chance to make a different choice. Maybe they just thought it was just one pill that was going to be okay. And it was just the same as what they had taken beforehand and it had a bunch of fentanyl in it. It's just given in the nose and that can reverse the opioid. It's a short period of time. And so you do want to still make sure that they're going into the emergency department because there's a bunch in the system. And if it doesn't work the first time, try another one because some of the fentanyl that we're seeing is really, really high. And so sometimes it takes really high doses of naloxone to reverse it. So it's okay to use more than one if someone doesn't respond. If they're not breathing, it's the best thing you can do. And you may easily save their life and give them another chance at life and a chance at recovery. There's a great Facebook page that shares all these great naloxone save stories and people who now are, raising kids and living these wonderfully productive lives after they were given a second chance with naloxone. So yeah, Project Hope, take a look. It's on our website with DHSS and 4As, all sorts of people dispense it across the state. I want to make sure that every Alaskan has it.
Absolutely.
And the
this
good part, Katelyn, real quick,
Go ahead.
the good news about the Narcan kits is they come with 2 doses. And as David has mentioned and Ann, with fentanyl, we might just have to use both doses. So very
Can you tell us
important.
how you use it?
I'm sorry?
Can you tell us how it's used?
I think the best thing would be if anybody is interested in getting Narcan, they need to go through a very short training that gives you all the information that you would need to be able to use it. And the good part, and I believe Ann can confirm this, is that it wouldn't hurt if it was not an overdose, meaning that if it's something else, you're not going to hurt the person by giving them naloxone. I think one of the most important things that I could say in the training is if you come across someone, the first thing you need to do is call 911. You need someone there because, as Ann mentioned, they need to go to the emergency room and get checked out. So I know some people will be reluctant to that. You also need to be aware that they might be a little agitated. They might not be too happy when they come out. So the training it's vital. You need to know what you're up against. And yes, it's very important, but I'm so glad that there are 2 doses in there because it might just take 2 if it's a fentanyl overdose.
Absolutely.
Well,
And
the
this
things I
question,
mentioned-
go ahead.
I just say there's no needles, there's nothing scary about it. It's super easy. And so it goes in the nose. There's a little push. It makes a spray. And just as Michael mentioned, there's no risk if you give it to someone for hurting them. They may go into kind of withdrawal. They may have pain or become agitated, as Michael mentioned, but that's just because you're pushing that opioid off of the receptor. That's all that it's doing. And getting them into the ER to make sure that when that naloxone wears off and that opioid rebinds, that they're still doing okay, can be important, but it can easily save their life. So don't be afraid of it. Use it.
Absolutely. And last question, what advice do you have for those that are suffering from opioid addiction or have relapsed recently?
My suggestion is keep connected, stay in relationships. Call your sponsor if you have a sponsor. Call the 982 HOPE, talk to peer specialists. We know that the disease of addiction is cunning, baffling, powerful, and now more than ever deadly because of fentanyl. So we just need to make sure that we are providing people with all the tools. And one last tool that was mentioned, that hasn't been mentioned, is the fentanyl test strips. That is also available through Project HOPE. You get a bag with directions. You get 5 fentanyl test strips. And as David mentioned, the manufacturing of some of these pills is very, very crude. And it's kind of like a chocolate chip concept where you get one cookie and you get a dozen chocolate chips, and then you get another cookie and it only has 3 or 4. That can happen in these pills. So you can actually crush the pills and dissolve them in water to be able to test them. You can test them. Project HOPE has a great Utah video on how to even test meth. You just have to use a lot more water. So these are vital in saving lives for people that are substance users, because we have to keep them healthy. We have to keep them alive so that when they get to the point when they are ready for recovery, they're still alive.
Absolutely. Well, thank you guys so much. That's all the time that we have for this evening. You can find out a lot more great information at drugfreeisuptome.org. I'd like to thank our guests and you, the viewers. I'm Katelyn O'Shaughnessy. Thank you all so much and have a good night.